Welcome back to Bay Sunday. Pancreatic cancer is considered the world's toughest cancer. November is Pancreatic Cancer Awareness Month, and there's a movement afoot to help patients fight this deadly disease and demand better care. Here to tell us more is Rich Valdes, a pancreatic cancer survivor. Welcome to Bay Sunday.
Sarah Valdes.
Sarah Valdes,
yes.
My apologies. So, Rick, tell us a little bit about your situation. How were you diagnosed with pancreatic cancer? Tell us your story.
Well, basically, I do a yearly physical, and because I'm such a wimp, I had this little discomfort on the top of my stomach, so I just casually mentioned to the doctor during the physical, and since I haven't been a very good patient in terms of having any illnesses, he got all excited, so we spent 10 months diagnosed my gastric problem, and we couldn't find any issues with gastric issues. He did a test to check the liver, a blood test, and it was elevated. And it was only then, after 10 months, we decided to take a CT scan. And that's when he found the mass on the tail of my pancreas. And when he told me, it was like a ton of bricks landing on my shoulders. But we never talked cancer. All I can think of was Steve Jobs, Patrick Swayze, all these healthy people. And then they succumbed to disease right away, and I thought I was done for. But he told me it was in a location where I could have surgery. And so I had the surgery, had it removed, and some radiation and some chemo, and I was cancer-free for after 6 months, but by March of 2014, it came back, and it metastasized into my lungs and liver, and I was given maybe 12 months at best at that time, and that was based on those current statistics. And I was given several options on what to do. I can let nature take its course, or take various chemo options, and having been in the Air Force for 20 years, you know, we go all out, you know, so we took the most stringent chemo, and it reduced my 11 tumors down to 8. But it was very toxic. I had to take a break. When I took a break, they came back. And then I participated in my second clinical trial, and during that clinical trial, which didn't work, it spread to my gallbladder, stomach lining, 3 lymph nodes, in addition to my lungs and liver. And then I was given just months.
Your case is rare, though. You went through 2 clinical trials, chemo, and you look great right now. What do you want everyone out there to know? People who may be in a situation similar to you, where they might see early signs of pancreatic cancer. Tell us what the Pancreatic Cancer Network is doing. Sarah.
Well, we're raising awareness for early, at least, detection of this cancer.
Tell us a little bit more about what you want everyone else to know out there about pancreatic cancer. Why is it so important to diagnose early? Obviously, all cancers, you want to diagnose it earlier on, but why pancreatic cancer specifically? Does it need an early diagnosis?
Because it's so insidious. It spreads quickly. And the early symptoms can be something like my stomach pain, back pain.
What about jaundice, too?
Jaundice, if it's on the head of the pancreas. Mine was on a tail, so I didn't have jaundice. So a lot of the symptoms can be interpreted to be a different disease. And so 71% of patients are diagnosed too late because they just kind of put it off because of their minor discomforts, because the pancreas is inside the abdomen, very deep. And so you don't feel tremendous, in most cases, tremendous discomfort. So you just kind of let it go. And during that time, it just spreads very quickly to the point where they do find it, it's too late.
Right. The 5-year survival rate has increased 1 percentage point over the past 3 years and is now 9%. Pancreatic cancer affecting 53,000 Americans. Tell us a little bit about what kind of inspired you and what else you're doing, Sarah, with this Pancreatic Cancer Network.
We're raising awareness. We want people to pay attention with any symptoms that they have, especially jaundice and stomach problems. They should go and talk to their physician and complain about it.
Immediately.
Thank you for joining us here on Bay Sunday, and thank you for sharing your story as well. If you or anyone know and need help, you can call PanCan for free, personalized advice at 877-2PANCAN. And to learn more about this, you could go to pancan.org/demandbetter. That is it for this week. Be sure to visit our website, cbssf.com/BaySunday, and our Facebook page. Have a wonderful Sunday, everyone.